So what is a standby emergency department versus a basic emergency department? This is a classification that primarily relates to emergency medical services or the ambulance, and from the San Francisco EMS and the California Department of Public Health. It doesn't really relate to how we are able to take care of patients per se. It more is a direct, it impacts what ambulance patients are brought to us on a regular basis. In a standby emergency department, there's different requirements. They need to have a physician on call, not necessarily in the emergency department. We've had a 24-hour physician coverage for quite a while and 24-hour nurse coverage, so that specifically didn't change. But they also have to be able to take care of every type of patient, pediatric, OB, trauma patients, even though they're not necessarily brought in by the ambulance, so on and so forth. But the biggest difference is they have to be able to take care of critically ill, unstable patients. As a standby emergency department, we don't get critically ill, unstable patients. And we only get patients that request to come to Chinese hospital. So previously, the way that it would happen is if the ambulance went to a call and there was a patient, they would ask that patient what hospital they go to. And if the patient didn't have a preference for hospitals and the patient was stable, they would go to the nearest basic emergency department. But that would not be Chinese hospital, even if we were a block down the road. So unfortunately for our patient population, that it was a break in the continuity of care. We couldn't take care of our sickest patients, which was unfortunate. So this was one thing that we wanted to change. Additionally, it also made it so we weren't able to help the San Francisco EMS when they were busiest, and often they'll have backups from ambulances waiting at emergency departments with no beds for hours and hours and hours. And Chinese hospital did not have, we didn't have the licensing to allow us to accept ambulances to decompress the rest of the emergency department. So that's one thing that we wanted to be able to help with. So those are the biggest differences. I will say that this also should be noted that this was really an altruistic motivation, if you will, from the hospital, and that most hospitals are actually trying to reduce their responsibilities in emergency departments, because financially it's not necessarily beneficial to be accepting all types of patients from ambulances. Hospitals financially do better with elective surgeries where they can check insurance status and so on and so forth. So this is really a break from the norm for Chinese hospitals to be doing this in this day and age where most hospitals are actually trying to step away from what type of emergency services they offer, whereas Chinese hospital has decided that they want to offer more emergency services, get all types of ambulances, and so that they can help the San Francisco EMS. And so that was exciting. San Francisco has their EMS services has, as I said, been overburdened for quite a while. So when we brought this to Dr. John Brown and Jim Duran, the administrator, they were excited that this would potentially help them as far as their mission and stuff, and be able to decompress the rest of the emergency departments.